Tragically, suicide impacts many of our lives. After someone we know takes their own life, we're often left asking, why didn't they reach out for help?
Help is out there, but as months-long Gephardt investigation has uncovered, getting the actual help paid for is frequently harder than it should be.
My son's life, there's no value I can put, monetary value I can put on his life.
Leah knows the pain that every mother fears.
And he sent out a group text thinking that he was going to take his life.
Friends texted the Safe Utah app, and an hour later, police showed up.
If it wasn't for that, who knows what he would have done?
After years of issues, this time his doctor prescribed residential treatment. Check him in at a home and leave him there for as long as it takes. Such facilities are not cheap, but the good news is that Leah's insurance, Anthem, covers residential treatment.
They sent me an email saying he's approved.
But after checking him in, Anthem came back and decided the treatment was not medically necessary. With insurance refusing to pay, Leah made the financially crushing decision to let her son stay and finish treatment. 85 days in all, and $88,000 of her own money. All for treatment prescribed by a doctor, approved in advance by insurance, and at an in-network facility.
Through the fight I've gone through, most people would have gave up long ago.
Leah hired an advocate to try and help her fight with the insurance company, but hasn't had any luck, so she decided it was time to call me. As we began digging, we discovered this is a problem that plagues the residential treatment community. We contacted 7 which specialize in adolescents, and each echoed the same complaint. It is always a fight to get insurance to pay. Most would only speak to us on the condition of anonymity, afraid that insurance companies might actually make it tougher on them and their patients. In fact, of all the facilities we called, only one agreed to let me in. Heather Black is the insurance coordinator at Sunrise Residential Treatment in St. George. It is her entire full-time job to fight with insurance companies to get them to pay for treatment.
I literally just had a family yesterday. I was notified that we had 192 days overturned for one of our families, which was awesome, like a full coverage. The other thing, though, if I might say so, is that they graduated in 2017. It's 2019, so it takes time.
This story that you're so proud of is because of a bill that they have been fighting for 2 years.
We didn't give up. We didn't give up, and it worked.
She believes the problem comes down to this. Covering mental health is relatively new. When there's a broken arm, insurance companies know there's going to be an x-ray. Kidney failure means there's going to be blood tests. But there is no test that can prove somebody is suicidal.
Well, why is she here? Because she feels sad? Well, we're not going to cover that.
To win, according to the U.S. Department of Labor, in 2016, they investigated 347 complaints from folks upset that insurance wasn't paying for residential treatment. A mere 26% of the time, they ruled in favor of the patient. Forces others to take their fight to court, which is where lawyers like Brian King come in.
They're aggressive about looking for ways to circumvent paying claims that really should be paid.
King says insurance companies have an unfair advantage. Because of the way that the law is written, it is up to the patient to prove that the denial was bogus.
It's remarkable to me the degree to which the insurers are aggressive in coming up with ways to deny claims that are recommended by all the treating physicians.
King says he hopes for a change to federal law that will hold insurance companies more accountable. But lawyer King is also Representative King, serving in the Utah legislature. He says a change to Utah law would help, but don't hold your breath.
You're talking about Utah can do more. Why isn't Utah doing more?
There's a lot of pushback when you put into place any sort of mandated coverage through mental health parity or any other kind of mandate. Insurance companies are wealthy. They have a lot of connections at the legislature.
Did it help him?
Immensely. He's a new child.
Was this necessary?
Beyond necessary.
So where does this all leave Leah and her family? We reached out to Anthem on their behalf to ask about all of this. A spokesperson told us they follow clinical guidelines when deciding which claims to pay and which ones to deny. Anthem did pay a portion of the bill before our calls. They have since settled with the facility, paying some more. In Salt Lake City, Matt Gephardt, 2 News.